It's 6:01. I'm going to wait a few minutes while people are still joining. I think we're going to have a few more people join us in the next couple of minutes. So we'll get started as soon as Joy tells me everyone is on.
Oops. Okay.
Joy, how are we doing? Are you ready?
We're ready.
All right, then we'll get started. Thank you for your patience, everyone, and thank you all for joining us tonight. I'm John Heilman. I'm the Mayor Pro Tem of the City of West Hollywood, and I want to welcome you to our virtual Human Rights Speaker Series event. The Human Rights Speaker Series was started, I don't know how many years ago, but we started, I think, about 15 years ago. And we've had the opportunity to hear from great speakers from all over the world and also activists on a wide variety of issues. We've heard from people from Death Penalty Focus, from Planned Parenthood. We've heard from people working on international HIV issues, from Doctors Without Borders. We've had Nobel Prize winners participate in our speaker series, and we're always so appreciative to hear the voices and to have the expertise that is shared with us here in the City of West Hollywood. It's Pride Month here in the City of West Hollywood. We haven't had the chance to go out and celebrate our pride in the streets like we normally do, but every year when we do our Human Rights Speaker Series event in June, we always try to focus on issues related to the LGBTQI community. And for the last, I think, 5 years, our focus has been on the international movement for LGBTQI rights. And it's great tonight that we are joined by several excellent speakers, some of them whom you've heard from before. I'm going to introduce them in a moment. But before I do that, we have a special welcome tonight from somebody who those of us in West Hollywood are very familiar with, and that's Jenny Peyser, who is just an incredible, dynamic attorney. She has been working for Lambda Legal, I believe, almost 25 years now. She is the law and policy director there. She's really been in the trenches fighting for marriage equality. She's also been somebody who has been focused on the issues of LGBT people and their families, children, reproductive rights, custody, and she's a longtime activist. And we're so fortunate, not only does she serve Lambda, but she is this year's co-chair of Outright International. And I wanted to allow you to join us and say a few words of welcome. I don't know if your co-chair, Michael Ighodaro, was able to join us tonight, but you can do a great job welcoming everyone, Jenny. Jenny, take it away.
Okay, well, thank you, John. And Michael Ighodaro was going to join us. He didn't have video access. Come together to do this together as a bit of a tango. So he's here with me in spirit. It's a great pleasure to have the opportunity to welcome everybody, and so thankful to have the opportunity to sort of encourage folks to open your ears and your minds and your hearts to hear these speakers who are tremendous, and to welcome, thank you all for planning to spend some of your evening learning about some incredibly exciting work that's going on around the world. I mean, Pride, as we know, is now a global phenomenon, which is hugely inspiring, hugely important. It is a great privilege of mine to serve on Outright International's board and to co-chair it with my friend Michael, and to serve on it with my friend and colleague and compatriot of so many years, John Heilman, who is on the board as well. He had asked me to say just a word or two about how the work of Outright Action International is complementary with the work that Lambda Legal and many other of the advocacy groups in the US do. And that's an important part of why I find the work so compelling. Some of these human rights themes that we grapple with in the US are very much the same themes resonating in the work around the globe. The human rights challenges have been real all over the place for a long time, and some of them are more acute here in the US, as we all know, given our current government, in ways that are not as different as they might be from challenges that our friends and siblings around the globe face. The fight to end conversion therapy, of course, is one, and you're going to hear about the incredibly exciting work of Outright through the presentation of Amie Bishop, who's doing remarkable research in the field. That, of course, is a big commitment within the US movement, and we're making progress both in terms of litigation and policy reform. Although our current government is trying to do things to make it easier for folks to practice conversion therapy, sometimes with US government money, which just spotlights the importance of this work. It's so important in the US and globally to be documenting discrimination, which is an important part of Outright's work, and of course it's an important part of the work here in the US. We have to be able to document it to show that it's happening in order to then be able to challenge it, whether in court, in litigation, or with policy reform. We need to be able to call on governments, which is of course an important part of what we do here in the US, that Outright does brilliantly at the UN, and that many of the activists that work with Outright do at the UN and with their home governments. And then of course it's all about partnerships with emerging leaders, as my friend Jeff will talk about the LA Center's work in China, which is just extraordinary, and with leaders in other parts of the world, community groups, friendly clergy, lawyers, and others who are able to engage with the folks that want to save lives, want to keep people safe, want to change government policy, and make the world where human rights are respected everywhere. So this is an amazing panel that you're going to hear. I'll stop there and I'll just say thanks for, as I said, opening your minds, opening your hearts, and engaging with Outright to know more about what's happening around the world. Happy Pride. We have a lot to celebrate, and we have a lot more work to do, as you will hear. Thanks, John.
Thank you, Jenny, and thank you for all the work you have done and continue to do for our communities. You're a great champion. And tell Michael we're going to hold him to come back and be a panelist maybe next year. His story is so compelling. All right, so I'm going to just quickly introduce our panelists. I'll give you a little bit more about their background when we turn to them. But our three panelists tonight are Amie Bishop, who is a consultant, and that sounds boring, but she is amazing, and she has done incredible groundbreaking work. We're going to talk to her. We also have Michael Rapley from Equals Barbados, who has joined us. Thank you, Michael, for being here to share a little bit about what's happening in your country as well as in the Caribbean. And then Jeff Chin has been with us on these programs many times in the past, usually as the interpreter for the Chinese activists and leaders who come here. But the programs that the Gay and Lesbian Center here in LA is doing would not happen without your incredible dedication to do this groundbreaking report. She's been working on how COVID is affecting LGBTQI communities. She's also been doing work, as Jenny pointed out, on conversion therapy and how that is impacting people around the globe. So I'm going to turn it over to Amie. Thank you for joining us tonight and sharing your expertise. And I believe you have a PowerPoint as well.
Well, that's just because I don't want you all to get bored by looking at my face. But John and Jenny and everyone from West Hollywood and LA, thank you so much for inviting us. We're really very excited to be presenting to you all. I am going to pull up a quick share my screen here. Because in this time of COVID, we knew from the work that Outright has done around the world for the last 30 years, actually, that we already know that at baseline, many of our communities around the world are economically disadvantaged, suffer from discrimination and stigma, particularly in the countries that still criminalize consensual same-sex relations, which actually is about 68 countries in the world, 9 of which still have the death penalty. So, and at the same time, there are amazingly vibrant and strong movements all around the world as well. So we felt that it was really important as soon as we could, as the pandemic was unfolding, to try and characterize how the pandemic and particularly the public health measures being taken to curb transmission were affecting our lives and our movements around the world. We wanted to basically sound the alarm. We didn't do this as an idle exercise. The point is actually to generate evidence to put before UN agencies, donors, humanitarian organizations, NGOs who are or will be on the front lines of pandemic response, to urge them with the data that we have to be more inclusive and attentive to LGBTIQ community needs. We did this work the sort of second part of March, the very beginning of April. The whole body of work was done in about 6 weeks, a little bit less. I conducted a literature review because we know that there is evidence from past emergencies and crises that our communities tend to fall through the cracks or are and sometimes willfully ignored. Although a lot of times it's actually sort of an inadvertent exclusion, let's say. And so that, as I mentioned, the kind of heart and soul of the work was conducting these interviews with nearly 59, nearly 60 people around the world, 38 countries, We used the strong and mighty team of Outright staff to sort of fan out, and you can see from the next slide, if I can turn it, that we tried very hard to get a good diversity of geographic reach. You know, it's not a huge number, but we really tried very hard to hit pretty much every corner of the world. In terms of the profiles of the people who we talked with, just under a third identified themselves as transgender. A little more than a third identified as gay or lesbian, and the balance identified as bisexual, queer, gender nonconforming, gender fluid. Some didn't specify, and we had 3 people who were intersex. So the way I looked at the interview data was tried to identify key themes that were emerging. And so out of this body of interview data, we identified 7 key themes. I'll review them quickly here, and then just a couple I'm going to give a little bit more detail from. The short version, the headline is that, as expected, LGBTIQ people around the world are being hit hard. You know, whether it's directly from the virus, but more likely, as we see among many other kinds of marginalized populations around the world, from the economic hit that is being suffered around the world because of the measures to contain the virus. So the economic fallout has been tremendous for our communities as well. The first theme, devastation of livelihoods and rising food insecurity. I am going to talk a little bit more about that, but this was a very dominant theme, and it was also reflected in, we'll talk about later, the emergency fund that Outright set up, but huge issues and very quick sort of moving into food security and food insecurity and hunger, surprisingly quickly. The next theme had to do with disruptions in healthcare, reluctance to seek care, and again, I'll talk a little bit more about that in a second. Elevated risk of family or domestic violence. I think we've actually been hearing about that more broadly, particularly as it pertains to women as victims of violence during these COVID times. But I want you to think about as well, when, you know, our communities, we tend to often find our own chosen families and safe places and safe spaces. And in many countries, especially younger people, have had to return to their family of origin during lockdowns and curfews. And many of the interviewees we spoke with talked about either feeling at risk themselves or knowing others who felt at elevated risk for violence because of sort of forced cohabitation with unsupportive family members, and not being able to be out. I mean, this is sort of related as well to the next theme, which was increased isolation and anxiety. I have the quote of one queer woman from Kenya reverberating in my brain all the time about this particular theme, who said to us that she felt cut off from the people who give us hope. And that really is very much, I think, reflective of many people around the world, who have found safe spaces and communities where they could be themselves, and now they are physically, literally cut off, and may not be able to be out in other domains of their life. The other brief story I recall is hearing from a woman who runs a program in St. Lucia, and she does counseling for LGBT youth, and was offering phone counseling, and talked about one of her clients having to go literally into a closet in a house to safely talk with her, which is, you know, quite a metaphor. Concerns about elevated societal stigma and discrimination. I'm going to talk a little bit more about that in a second. State abuse abusive state of abusive state power, it gets me upset, really is about issues of increased militarization, taking advantage, sort of using the cover of COVID to extend states of emergency beyond what is actually required. That we are seeing increases in surveillance, for example, in a number of countries, and with people telling us in places, I mean, China, that is already occurring, but even more so now, South Korea, Singapore, saying, we don't think that when this crisis is over, we're actually going to go back to where we were. We think these surveillance mechanisms are going to stick around. A lot of concerns about that. And legislation that's being put forward during this time that is harmful to our communities, such as what happened in Hungary, where a law was passed that prohibits transgender people from legally changing their gender marker. So this is the kind of abuse that we're talking about. And then finally, anxiety about organizational survival really, again, speaks to the ways in which the frontline organizations, community-based organizations, advocacy groups, these are not large, well-funded, robust, entities. They are scrappy, generally not huge, not hugely well-funded organizations, so that they don't have a lot of reserves. And there's so much uncertainty about what's going to happen with the donor landscape, whether the donors will shift away from human rights work and really focus more on COVID. We had a number of people tell us from various parts of the world that they really felt like the pandemic literally may set back their movements by 3, 5, even 10 years. So this is hugely concerning. I just have a few sort of examples of some of these themes to share with you. We heard in the Philippines, this is a lesbian couple we talked with, the Red Francisco, who told us that when the local government was offering food support for people, that they came to them and asked if they had a husband, asked if they had a child, and when the answer was no, they were told they were not eligible for food support. And the only way they actually were able to access additional food was because they had they were sharing their household with 2 other families who were willing to share. But this, and I have to add a little footnote, which is that Outright's Asia program coordinator, Ging Cristobal, who's based in the Philippines, actually intervened after hearing about this story and changed the outcome there. But this was initially what was happening, and we heard about it from other people we interviewed in the Philippines as well. Another example in Sri Lanka, where it is still, where being gay is still criminalized, food support was being provided in one part of Colombo through the police stations, which was absolutely an unsafe venue from which to receive this support for LGBT people. Disruptions in healthcare. So the themes here really were about reluctance to seek care, being kind of one area. And this really speaks to the kind of discrimination that people historically and, in normal times experience, where people are very reluctant to get care unless they're really extremely sick because of stigma, discrimination, lack of respect for confidentiality, misgendering, a whole host of issues. So Naya here, a Syrian refugee in Lebanon, was essentially making this point that even in the best of, so-called best of times, that the LGBTI community is not included. So now it's even worse. And that is something that we heard repeatedly. And we did also hear directly about people who were suffering, who were exhibiting COVID symptoms, but actually not hesitating to get care because of worries about how they would be treated, which of course under the circumstances is potentially lethal. Other issues had to do with disruptions in things like HIV medications, in hormonal therapies, and other kinds of gender affirming care, which had been deemed non-essential. It's just, I think, particularly important to note that trans and intersex people were particularly impacted by lack of access to hormones, that it may be deemed non-essential by some, but it's very much essential to them. Oh, I know the other, sorry, I was hesitating because we do have some great examples from the interviews of people who have banded together to try and, identify ways to access medications to bring back to the community. And one story like that, if you look at the report, you'll see from the LGBT center in Wuhan, China, actually organized a way to access their HIV medications. Incredible under the circumstances. The last theme I just want to touch on a little bit more deeply is we've seen it historically, but again with COVID, our communities are getting blamed because of the sins of our lives, et cetera, et cetera. So it's religious leaders, it's political leaders, and Karishma, who's in this on this slide here, is someone I do actually quite a lot of work in Liberia, and I know Karishma and did the interview with her, and she first of all was saying this is just like what happened in Ebola. In Ebola, we were hunted down. We couldn't go outside because of threats to our physical safety. And she, again, you can see this quote, but she was talking about the same, that this is happening again with COVID. So I'm going to switch a little bit. Let me just say before I turn to our emergency fund work that again, the point of doing this research, and I really urge those of you who want a deeper dive to go to Outright's website to look more in depth at our findings and many, many stories and profiles of individuals. But we really are trying very hard to get the data that we have in front of key humanitarian responders and donors to urge them to look at a more inclusive approach. So again, just to highlight the point of this is really being for the purposes of advocacy. So I'm gonna switch. So at the same time that we launched our research, we also launched an emergency fund, and it's to provide assistance to grassroots LGBTIQ organizations, some of which I described, small, working very much on the front lines. We've raised a bit more than $900,000, which is kind of incredible. We started out with a lower goal, but when we realized the need that existed, Katie Holtquist and others really accelerated their efforts to identify funds, and it's been amazing. We've gotten funding from more than 200 companies, foundations, individuals, including Microsoft, Calvin Klein, and a variety of others. We again worked very quickly. We issued the applications on the call for applications on April 8th. And during our 3-week application period, we received 1,488 applications from 131 countries. It blew our socks off. The degree of need that we saw and how quickly people sort of seized the opportunity was astonishing, really. And the highest number, as you can see from this chart, the highest number of requests were from Africa, followed by Latin America. The grants themselves range from $2,500 to $10,000, with the average being around $7,500. So I'm going to go to the next slide here. What was interesting too in terms of needs is that the applications, as I briefly mentioned earlier, really supported the feedback. They kind of mirrored the data that we gathered through the interview work. For example, the most common request for support was for food assistance. So about 57% of all those applications were for food, 10% for shelter, 7% for healthcare. So you can see from the pie charts what that looked like. The population served were pretty diverse as well, but really illustrated a particular need in the trans and non-binary, gender diverse category, if you will. And this again reflected what we were hearing about the particular vulnerabilities of transgender people through our research. And then the bulk, 69% was sort of focused generally on the entire, the full community. So this is my last slide, and it's I wanted to end by sharing Outright's theme, which we're calling Pride with a Purpose. We're commemorating Pride this year by, of course, protesting racial injustice and police brutality against Black people, lifting up our history, our LGBTIQ history as a movement started by trans women of color, and really insisting that there can be no pride without a commitment to racial justice and Black lives. And we're amplifying the severe impacts of COVID-19 on our communities worldwide. So I would not be doing my job if I weren't providing some ways for you all to help. And John may echo later these requests. But first of all, as I said, we want to have this report get out far and wide. So if you know anyone who might be interested, who may have some connection to COVID response, please share. The second is to continue to promote the fact that we have this emergency fund. We have a huge number of applications that are qualified, but we don't have the funds yet to provide to them. So we are continuing to fundraise through the end of June, hoping to be able to support a few more organizations. We have got quite a robust webinar series, and we've also started another kind of series called Outright TV, which is sort of the production values are not super high. They're quite homespun, but it's really opportunities to hear from activists from all over the world, including in the U.S., to talk about whether it be how people are coping with COVID or Black Lives Matter or a whole range of issues. And of course, please follow us on our various social media channels. So I hope I didn't go too over time, and I thank you, and I'm very happy to answer questions when the time comes. I'm going to turn off my screen. Back to you.
All right, Joy, you're very tricky there. Thank you so much. Amie, thank you for, first of all, the work you did in putting together the report, but then sharing it with us tonight. It really is incredible to see the need out there. And of course, we know the need locally, but you're sharing that people throughout the world are experiencing the impacts in a much more profound way. So thank you for sharing that today. You talked about the grant program that Outright created, and I got a chance to review some of the applications, and the need out there is so overwhelming, and the organizations requesting it are so courageous. They're working in places, as you said, where being gay is criminalized, and in some places it's punishable by death. So the challenges they're facing is just, it's mind-boggling for those of us who live in West Hollywood. I wanted to turn it over now to one of our grantees. You talked about this grant program, and we're so lucky to have Michael Rapley here from Equals Barbados. He's the chair of that organization, and he can share a little bit about what you're doing with the grant, what are things like on the ground. And I know that your work extends well beyond Barbados, because you partner with lots of other organizations working in the region. So Michael, I'm going to turn it over to you, or actually Joy is going to turn it over to you, and please share a little bit of the work you're doing.
Thank you very much, John. Thanks again for having me. And so, yeah, as John said, my name is Michael, and I'm the chair of Equals here in Barbados. I'm actually just going to go straight into the presentation, because we start with a bit about who we are and what we do, and then we go into a bit about how Outright has helped our community here in Barbados with their emergency grant. So who is Equals? Well, we became a registered organization in Barbados in 2013. And our main mandate when we first started was to create safe spaces and help promote safer sex within the LGBT community. But as time grew, we realized that we needed a holistic approach to that, but also the community needed a lot more than just access to HIV services. They needed access to regular healthcare services, to mental health care services, to social services. And so we then broadened our scope of work to try and really be able to refer them or provide these services ourselves. And so we were lucky enough to actually open our own community center in June 2017, ironically Pride Month, which is great. So this marks our third year that we've had the space open. And that was through a USAID and PEPFAR initiative, the Linkages Project. And the whole idea behind that was that we would be able to provide the HIV testing services ourselves, because the community was not accessing them at public sites. And so, you know, and they couldn't afford to go private. So we really needed to be able to have the community accessing these services. And throughout the 3 years we've been on this program, we've been able to offer that HIV and STI testing. We were the first community site in the Caribbean to offer PrEP just early last year in February. We started offering antiretroviral treatment late last year as well to those who wanted a more discreet place to access that service. From the beginning, we were offering psychosocial counseling. We also partnered with the Barbados Family Planning Association here to have a doctor's clinic for general checkups. And we also had a volunteer doctor in the early stages of opening who volunteered her services and is now our site physician who does the PrEP and the ART services as well. We also do support groups for the community as well. And the community center really also acts as a safe space for our community to be able to express themselves who they are, because there's very little of that in Barbados. There used to be clubs and bars, but now there's very little of them. There's very sporadic parties that happen, and that's the only time that the community has to engage in each other properly. So this is a way that they can engage with each other under, you know, without the influence of alcohol and other substances. And so also at the community site, we have amenities such as the Wi-Fi. We have computers where the community can work on, do work or study. We have the kitchen amenities there. You know, we have a conference room if anyone needs to host meetings. We also do sensitization workshops for service providers, and this has been targeted mainly at the healthcare sector, since that's the area that a lot of our projects have been focused on. But we recently were able to develop, myself and my colleague, Dr. Anastasia Rembrandt, created a diversity and inclusion training manual for the region that will allow to be targeted to the audience that you're really, that your target audience is. So if it's the police, or if it's the education institutions or corporate entities that need to update their written policies to be more inclusive, this training manual really allows for that message to get across and for them to really receive proper training in that area. All of our staff are trained in HIV rapid testing and phlebotomy, so we don't really rely on the Ministry of Education here for assistance. We did at first, and over time we got the training necessary for these staff, and that allows us to be able to be more flexible with the services that we offer, even though we have a great relationship with the Ministry of Health, which is why we're able to do this stuff. So we're very grateful to them as well for all the work that we've been able to do. We also do human rights violation reporting through the Shared Incident Database, and that's a regional database that is hosted by the Caribbean Vulnerable Communities Coalition to record human rights violations for the wide spectrum of marginalized groups in the Caribbean, including LGBT persons, because persons don't report incidences here. One, because they don't know their rights, and two, because the police do not take them seriously, or if they take a complaint to their employer, the HR department does not take it seriously. So we decided that we would come on board with the Shared Incident Database, because a lot of the times we hear politicians and religious leaders asking, where is the evidence that the LGBT community is discriminated against? Because it's very discreet here. It's not really that physical in regards to discrimination. It's not very that physical and visual, but it's very subtle, and that's why we need to be able to show the evidence that our community is discriminated against. So why do we need the Outrage Emergency Grant? So Barbados was hit by COVID in the week of the 16th of March, and so we went on curfew that day. And so businesses has to close, and as you can imagine, a lot of our economy comes from the tourism industry. So businesses closed, and over 36,000 Barbadians, and that's nearly 30% of the workforce, on top of the 10% already unemployed, had to file for the unemployment. And they only recently received the benefits in late March, which I think early June, which was when they gave the initial presentation that these slides are from. We recently just finished a survey, and the preliminary results of that survey that show the impact of COVID-19 on the LGBTQ community noted that over 35% of the community had actually lost their jobs, and then another 25% of those who responded have reduced hours. So you can really see the effect it has had on our community, because many LGBT persons in Barbados work in hotels and restaurants. And so they're out of work. And while the PM requested that landlords don't evict the tenants within this time, there was no legislation to prevent landlords from actually doing so. So what we requested from Outright was funding to provide care packages and help persons with rent. So we already had something that we call the covered affair to help persons who would come by normally if they needed food, because again, they weren't working or they're being neglected at home, that they could come and get something to eat. But we really took this initiative to the next level with this grant. And so we had a target of 40 care packages within our proposal, and we were actually able to create over that, 46 in total, with a few leftovers. So we got a few donations from individual persons, and we were able to complete another 14 packages for a total of 60 within by the middle of June, actually. And then we also applied for assistance with rent for persons of up to 10 weeks, and we were actually able to reach 6 persons covering 14 weeks in total. So we were able to help most people with 2 or more weeks of rent. And we also, within this, created simple recipes like infographics to help persons make use of the items in care packages, because some of them might not be accustomed to using the basic items in the care packages and might need some inspiration. So we also provided them with that. And in executing this, we partnered with Sexuality, Health and Empowerment Barbados, which is also known as She Barbados, who is an organization that works primarily with LBQT women to help us extend the reach into the community and make sure that we reach everyone who is in need. So this is just an example of some of the infographics that we would have sent out on WhatsApp, which is the main way that we communicate here in Barbados, so that they had something visual and that it had all the information there. And then this is just a few photos of us. That's myself there with the founder of She, Rowan Mohammed, who's also on the board of directors of Equals as well, where they're packaging, and you can see the care packages that we have there and the items that we used. So yeah, that's sort of it. Just before I end, I just wanted to say, going forward, we're really looking at trying to equip the community with being able to enter the workforce. The training manual that I mentioned before, we really want to try and utilize that and get companies to buy into that. And there's actually a bill currently in the House of Assembly waiting to be voted on, the Prevention Against Discrimination bill in the workplace. So we're hoping that that passes, because that speaks directly to discrimination against those based on sexual orientation, and indirectly to persons based on their gender identity and gender expression. So we're hoping that if that passes, we can really gain momentum and help organizations to be trained and to really rewrite their written policies, because that's a part of the bill as well. Once it gets passed, they have 6 months to rewrite it. So that's one thing that we're looking forward to being able to do and hoping that we can do to help equip the community and give them more opportunities coming out of COVID-19. So I would like to thank Outright International, Action International again, and all of the donors who donated to the fund, making our relief efforts possible. And we're always looking for support. Just like Amie said, you know, we're actually losing our funding at the end of next month. So to be able to keep doing our efforts, you know, we would, if there's anyone that wants to support that, that'd be great, because the community is in need of that. But if you also just wanted to support the efforts, we do have a waiting list for those with care packages while we await donations as well. So you can contact us on our social media or email us. Thank you very much. John, I think you're muted again.
To people that your website is available to people. So thank you very much for the work you're doing and being with us tonight to share that work. And it's amazing the work that's being done in areas where we know that LGBTQI people are so impacted by economic oppression and the economy. Here in West Hollywood, we're having the same issue. Many of our younger people certainly work in hospitality, and with all of our hotels and restaurants shut, it's really impacting them. You mentioned something about being a registered organization. I should bring that up as an issue that Outright is also working on. In many parts of the world, you can't just be an organization and operate. You have to register with the government. And if you don't comply with those registration requirements with that particular government, you're not allowed to legally operate. You're not allowed to legally accept funds. You're not allowed to have office space. So one of the issues that Outright has worked on over the years is challenging those registration requirements and helping LGBTQI organizations with the registration process where registration is possible. I'm going to turn now to Jeff and have him share a little bit about the work that the center is doing. Those of us who are here in Southern California, I think we all know of the incredible work that the LGBT Center does. I mean, it is the largest HIV provider. It is amazing in terms of its programs for LGBTQ seniors, the work it does in terms of outreach to LGBT youth who are on the street and homeless, amazing programs. But I don't think most people are aware of the groundbreaking international work you're doing. So Jeff, share with us a little bit about the work you've been doing, particularly in China, and also tell us a little bit about how COVID has impacted that work. So I'm going to turn it over to you now, Jeff. Thank you for joining us.
Thank you, Jenny, and thank you, Joan, for your great introductions, and thank you, City of West Hollywood, for putting this together. I'm so honored to join this panel and absolutely admire the outstanding work done by Outright International and Equal Barbados. The Los Angeles LGBT Centers was founded in 1969, and it is the largest LGBT organization in the world. Currently, we have over 800 staff and more than 42,000 client visits each month. We run more than 60 diverse programs at 10 locations across Los Angeles. My program, the International Project, is only a very small part under our public policy and community building department. The center's mission is to build a world where all LGBT people are equal, healthy, and complete members of societies. So hence the center has been working with LGBT activists from around the world for many years. So China, it has 1.4 billion people. So if 6% of them are LGBT, which is a very conservative estimate, then the LGBT population in China would be 84 million. If the Chinese LGBT community was a country, it would be the 17th largest country in the world, same as Turkey, and just a little more than Germany. So the center believes China is the most populous country in the world. If we can help advancing the LGBT rights there, it will not only improve the lives of LGBT people there, it will also create this ripple effects to other countries, both in the Asian Pacific region and around the world. So when we first started the China program in 2008, we knew very little about the Chinese LGBT community. We were approached by an activist and later become a project partner to assist in the training and development of young emerging leaders in China. So the internship provides an opportunity to experience and be inspired during the 5 to 6 weeks time in Los Angeles, especially at the center where they met and learned from our staff in every departments and programs. They also had the chance to participate in some of our signature events, such as like AIDS Life Cycle, or Annual Gala, Motor Surprise, and so on. In addition, so we also arranged some off-site visits, such as to the Williams Institute at UCLA, One Archives at USC, Lambda Legal, API Quality LA, Chinese Rainbow Associations, just to name a few. And to date, we over 100 young activists have graduated from our program. They've made a significant impact in a relatively short period of time. The program has had an impact on the life of many individuals. In fact, it would be nearly impossible for anyone to engage with the LGBT community anywhere in China and not find graduates of the program playing key leadership roles. So our partnership has contributed significantly to the LGBT movement in China, which include increasing self-sustaining funding strategies, growing a national network of LGBT leaders to advance LGBT rights, developing more effective social change plans, building alliance across civil society sectors, and increasing public awareness of the challenges faced by Chinese LGBT people. And this work has encouraged and support LGBT individuals to come out and be visible to their friends, coworkers, and parents. This means that not only more organizations can be funded and supported, but for example, lawsuits can be filed for the first time since they are now openly LGBT people willing and able to serve as plaintiffs. So during the last decade, and in the partnership with the center, the Chinese LGBT community has grown in size and effectiveness at a more rapid speed that has ever been the case in Western democracies. And this has happened as the government has increased surveillance of LGBT activists, limited the freedom to organize, and implements laws harmful to all civil societies and human rights activities. So next, I'm going to talk about COVID-19 and its impact on the Chinese LGBT community. So as you know, the novel coronavirus emerged from a live animal market in Wuhan in late January, which was on the eve of Chinese New Year or Spring Festivals, the largest and most important holiday in China. So in 2019, there were like around 2.9 billion passenger journeys during the Chinese New Year travel seasons, which usually begins 15 days before before the New Year and lasts for around 40 days. So many people had traveled back to their hometown in preparations for the Chinese New Year celebrations. Just like LGBT people here in the US, the holidays can be a really tough time for LGBT people in China as well. Many of them are not out to the family or do not have affirming and supportive family. So in a normal year, they would just leave behind their gay outfit, their lifestyle in the city, and spend a week-long public holiday with family and friends. And during Chinese New Year gatherings, usually their parents or relatives will ask many questions about their lives in the city, how much they make, if they bought a house, or like if they have boyfriends or girlfriends. Of course, it's opposite sex. And if the answer is no, then the beginning of the nightmare, because matchmakings or blind dating arrangement will follow soon after that. So while many matchmaking and blind dating activities were canceled this year because of public gathering of any kind was prohibited, thank God, LGBT people did not get a break from the nosy and intrusive family. So as they were spending extensive time together, some parents eventually found out their children are gay or lesbian or even transgender. So we have heard that parents forced their children to undergo conversion therapy or to seek help from other mental health professionals so they can be corrected or can be cured. And on the other hand, we have also heard that some LGBT people use this extended holiday to come out to their parents and spend time explaining and educating their parents about LGBT. Some of the LGBT organizations continue to offer the hotline service during Chinese New Year holiday, where parents get to talk to other parents how to accept or understand the LGBT children. The hotline service, either providing peer support or more professional mental health and counseling services, become crucial during this time. Some calling for help, while others simply need someone to talk to or just find a safe space and comfortable space. And it was a different story if you were on medication, such as taking HIV medication or undergoing hormone therapy. So when these people traveled back to their hometown, their plan was to stay for a week and then return to the city. So they didn't have extra of the medications, and in most cases, the family has no idea about their medical conditions. So for those who live in Hubei province, for instance, when the city and the province went into total lockdown, they had no way to access their medication. So LGBT organizations that offer HIV and testing and counseling services immediately become the life-saving driftwood for people living with HIV. So they receive high volume of messages on WeChat or on the phone, and staff immediately started to mobilize the volunteers and use the connections to contact other organizations across the country to ask around and to borrow the HIV medications from people who were less affected or who had extra supplies. In one case, as Amie mentioned earlier, the Wuhan LGBT centers, whose executive director is a graduate of our program, led a team of staff and volunteers to help clients pick up the medications from the designated hospitals, while he himself was actually stranded in another city. So in China, HIV clients have to go to designated infectious disease control hospital to get treatment and medication. And during the outbreak, those hospitals were treating COVID-19 patients instead, so making it even harder with the good relationship built over the years with local governments and hospital management, was able to get the clearance and permit to leave the house and travel to the hospital to meet with the doctor, get the prescription, pick up the medication, and mail them to the clients. So during the quarantine period, they helped over 2,500 people. So we also received some referrals from our fellows in China, where Chinese tourists who had traveled to the US prior to the travel ban were unable to leave the country. So by late February and early March, they had run out of their HIV medication. So they call me, and then I connect them with our health clinic in Hollywood. We set up the doctor appointment through telehealth and make sure that they get the medication in time. So actually, one center team was originally planned to visit us in February to learn more about organizational developments and team capacities building. But however, of course, you could guess the trip was canceled because of COVID-19. We're still hoping, to see them in the near future and hear more of the stories in person. Actually, the similar situations for transgender groups as well, where they receive many help requests, both for health and mental needs, to connect with each other and help their trans sister and brothers to get the hormone or other help that they needed. Other than LGBT individuals, COVID-19 also impacted LGBT organizations in many ways. First being financially. So as mentioned by the other two panelists tonight. So during the past few months, LGBT groups reported a big drop in the individuals' donations, monthly donations, somewhere between 30 to 60%. So as people were forced to take unpaid leave, experiencing pay cut, or even lost their job, so they were unable to make monthly contributions. So some other previously committed funding was also interrupted. Some corporate sponsorships have shifted from monetary to in-kind donations. Some of the LGBT organizations have reached out to us for assistance. So we talked to our funders and donors to redirect some of the existing funding, to provide emergency organizational support, to help to pay for the office rent or other admin expenses, or the support services that respond to COVID-19. So those organizations also had to cancel all the in-person activities, training, meetings planned after Chinese New Year. So instead, they were conducted online over several social media platforms. So when crisis turned into opportunity, they had to come up with so many creative ideas to continue the work that they do. While online sessions lack face-to-face interactions, but it allows people who were previously not able to attend due to distance can now join some of the events. And some LGBT people also found their own community for the first time online during the lockdown. So COVID-19 affected the Chinese LGBT community in different ways, depending on their geographical areas. So folks in the southern region, such as like in Guangzhou, actually returned to work in the office by the end of February or early March, while those who were in Beijing area didn't resume the operation in the office until mid or late May. And then in Beijing, authorities confirmed the first local COVID-19 infections on June 11th. The second wave seems under control now, but many offices are closed and staff have returned to work from home. So as most of the LGBT centers are actually located in high-rise residentials and business mixed-use buildings, it has become more difficult for non-residents to go in and out of the buildings or gated community, where they need to be checked for temperature and ID or permits for access. This would prevent LGBT centers to host any group activities or gathering in the future. So some of the center has started the process to relocate to more remote areas, or in some cases to move into office buildings, which have lots of vacancies because many small and medium-sized enterprises have gone out of businesses. So the rent has dropped, which actually give an advantage to the LGBT centers. So kind of like finding a silver lining in every cloud. So I can go on and on, but I'm going to stop here with the positive notes and save some time for Q&A. Thank you.
Thank you, Jeff, and thank you for the amazing work you and the center have been doing for many years now. And I know how challenging it is to get funding into China, how challenging it must be given the time difference to be providing services to people. But you've been doing this program, and I've had the chance to meet some of the people because they've been at these Human Rights Speaker Series events in the past. It really is incredible work, so thank you. I want to let everyone who's here tonight, let them know that if you do have questions, put them in the chat room. Joy is coordinating that, and we'll ask our panelists. So we're going to turn, we have about 15, 20 minutes left for questions. My first question, I think all of you answered to some degree. What can people here in the United States or in Southern California do to support the work? Amie, you mentioned going on Outright's website, following Outright, donating to the COVID fund. We have all of that in the chat room. Michael, you mentioned the incredible need for your organization for the food and packages that you're putting together for people. We have your website in the chat room as well. And I think everyone knows how to donate to the center. If they don't, they should. So financial support is, of course, very important for all of the organization and all of this work. But in addition to that, is there something that you want to add that people here can do to support the work that's being done internationally? Amie, do you want to jump in?
Yeah, I mean, I think I more or less said it, but I think my main point to kind of get across is that, you know, LGBTIQ movements around the world are incredibly resourceful. They're strong and determined despite a whole range of inequities, discrimination, inequality, and even violence that's denied them access to education and healthcare and housing, and as I was saying, kept a lot of people in poverty. And what's happening now is a new level of vulnerability. It's a real humanitarian crisis for a lot of people, especially for those who suffer from multiple sort of intersecting vulnerabilities, gender, et cetera. So I think what I really hope people will do, aside from finding ways to perhaps financially support, but just to share what you're hearing, what you're learning this evening from various speakers with your friends, your colleagues, your communities, because I really fear, and we at Outright, I think, worry that especially during stressful times that we're all experiencing, we tend to kind of narrow down into our own worlds, and this is actually not a time to do that. And so, to the extent that you're able to share what you're learning, I think that is, to me, the way we keep our heads up, keep focused on what's happening globally to our communities around the world.
Michael?
You can let us know, and we can probably put you in direct contact with anyone who has a Airbnb here, who's a part of the community or an ally to the community. You know, that's another way that I think, you know, people can directly help. But following, you know, our social medias, we do a lot of original content as well. Sharing that, you know, building up our presence online will also help us as well. So, you know, there are different ways that you can help.
Great.
So I just want to echo what Amie just mentioned, is to provide support, share the stories that you heard today with people, and not just, you know, knowing that global LGBT community from a broader perspective, not just based on news report, but from other channels, and within your own capacities, provide support in the form, it could be financially, emotionally, or professionally.
That's great, Jeff. And I think we do hear news reports that are typically reports about a country or a dictator acting to oppress the LGBTQ community in that country. And we sometimes forget how there are so many of these organizations throughout the globe, that they're incredibly resilient, they're incredibly creative. They find a way in places that are very challenging to make progress. And we should be saluting them and supporting them, not just financially, but echoing their stories and making sure that those stories also resonate. And I wanted to kind of shift to that topic. We're talking a lot about COVID, and that was tonight's topic, but why don't we talk a little bit about prospects for positive legislation, for example, in the Caribbean? What do you think that the chances are, the likelihood of moving forward with non-discrimination, marriage equality, those kind of initiatives that we've been, you know, fortunate here in this country that we've made a lot of progress. What do you think the likelihood is for progress in Barbados and the rest of the Caribbean?
Well, I think that we're a bit of a ways off from marriage equality. In many of the countries, the buggery laws are still on the books. So the act of anal penetration is still illegal. There have been a couple of movements, a successful litigation changes in Trinidad and Tobago in 2018, and Belize, I can't remember which year, but I think it might have been the same year. So we're hoping that that sort of spurs a movement, and actually Equals is a part of a case being taken to the government right now to remove the Buggery and Serious Indecency Act in Barbados as a part of a regional movement under the Eastern Caribbean Alliance for Diversity and Equality, which is also known as ECAID. And this regional act is, sorry, it's late here, so my brain is getting a bit fried. But it's also being challenged in St. Kitts and Nevis, Antigua and Bermuda, Grenada, and St. Lucia. And then a couple of other countries are doing their own as well. So there is right now some movement to start to act on the litigation that is is discriminatory. But as I said, there is this employment bill in Barbados Parliament right now. So we're crossing our fingers on that. We want to do a bit of activism, hopefully, around that to get that passed. And as I said, if that gets passed, do our own movement on that. But I think that we also need to try and tackle the attitudes of the culture and society in these islands as well. Because, for example, as I said, Trinidad repealed the buggery law to only be unconsensual anal sex. But then the House rejected LGBTQ persons being included in their domestic violence bill. So, you know, one thing does not necessarily lead to another thing. So legislation change does not necessarily lead to attitude change. So it's about doing the work together, and that's sort of what we want to do. in partner with our other organizations here in Barbados, and use the allies that we already have to extend our reach. So it's going to be slow. I think that progress can be made. We're trying to do the best approach that we can. Obviously, nothing's perfect, but I think slowly it will come around. But we're hoping, you know, as the others have said, that the COVID-19 pandemic doesn't put our movement back, because, you know, we have had a couple of incidences where people are blaming us. Like, I think the week after shutdown and when we were opening back up the country and doing an alphabetical system, there was this lady outside the supermarket complaining that the LGBT are to blame for the COVID-19 situation. And she was going on and on and on and on about it. So, you know, we are very much also feeling that. So we're just hoping that we can all get through this together.
Thank you. Thank you for sharing that with us. And, you know, Outright has worked very closely with a number of organizations in the region, and they're so impressive. The work that's being done, the challenges they're bringing in courts, the challenges they're bringing before international bodies, the resilience and the strength of these activists is really admirable. And thank you for being one of them. So, and thank you for being here tonight. We have a question from the audience for Jeff about the increased surveillance in China, and how is that really impacting the work that the activists are doing, and the battles that we're having right now in this incredible movement for racial justice that we're experiencing here in the United States. Is that carrying over to China? Are we seeing some of the same fights happening there? Because we know that there's obviously discrimination within China, within different groups in China. It may not always be racial, but certainly they're not exempt from the racial discrimination that exists globally. So I wanted to give you a chance to comment on that.
Yeah, I think when COVID-19, when the outbreak started, we thought that civil societies or the LGBT groups would get a break from public security officers, but actually it's not the case in reality. They continue to receive periodical or regular phone calls from the officials that have been working with them for a long time to check in on them. As I mentioned earlier, a lot of the activities had shifted from in-person, offline, to online. So that's also subjected to a lot more monitoring from the government, because all the platforms, the software that they use to host these activities, meetings. So it's easier actually for the government to monitor the content of the meetings, the sharing, and things that they talk about in those. But at the same time, it also allowed the public security officers to understand actually what they are doing. So some of the things, because they have received different information from different sources, in a way, sometimes they accuse the LGBT activists of doing something that they didn't do. So this is a way for them to get to learn about what those organizations are actually doing. And in terms of course, China has its own racial and political issues. Usually, we don't get involved, or very few of our fellows get involved with those issues, but we do provide technical assistance if it ever raised and come to us in how to handle such and such issue, and what kind of positions that people should take, or what stance that they should take. The good thing about, as I mentioned, we have the China program. We have over 100 graduates from the program. They themselves sort of form like a network, like alumni of this program, and they get to talk to each other, to think as a group, what is the best way to advance the movement. So I think that created that platform for people to respond to not only help the community, but also when crises arise.
Just a follow up, I think in the United States, we obviously struggle with LGBT organizations and activists sometimes not recognizing the importance of inclusivity and not recognizing that the fight for racial justice is part of our fight for equality for all LGBTQ people. Do the activists that you're working with in China understand that the struggle for LGBTQI rights also has to embrace the struggle for human rights generally, and particularly the struggle surrounding racial and not just racial, but all forms of discrimination?
I think it happens and it comes up to us from time to time. And that's also the good thing about this partnership between us and them. When I say about us, it's not only the center here in the US, but we also have other activists in the US that they look up to. So whenever, you know, issues arise of questions, we usually refer them to people who are more experienced in the LGBT movement here in the US, such as John, yourself, and Jenny, and a lot more very experienced activists here in the US. Because a lot of time we'll get call, email from them and ask like, hey, we have this issue or this conflict. Does it happen in the US? And how did they solve it? So they actually learn a lot from the LGBT movement here in the US, and hopefully that they don't repeat the mistake that we have made, and save them a lot of time in advancing the movement or the LGBT rights movement in China.
And of course, we still have a lot to learn as well with our movement here. So thank you for that perspective. We're almost at the end. I do want to share one of the comments in the chat room. Just thanking you all for the amazing work that you're doing for the LGBTQ community around the world. So I wanted to make sure, I don't know if you can see that, but I just wanted to share that with you and the rest of the participants. I also want to give a shout out. I think you mentioned her, Michael. Roanne Muhammad is here on the call. So thank you for being with us tonight. Thank you for the work that you're doing and have done. I want to give a shout out to Katie Hultquist from Outright, who is on our call as well. She is the West Coast director of Outright, and she's up in Seattle, but she's down here in Southern California frequently. Thank you for the work that you do, Katie. Closing words, I'd like each of you to maybe just give a sentence or two on what do you think is the key takeaway you want people to remember from tonight's conversation. Who wants to start? Michael, you're scratching your head, so maybe I should call Jeff first.
So I think we live in a global village. So globalizations create change, the momentum for change. So we have to act together. When we take action together, we become stronger. So we'll need to take care of each other. I want to close by sharing this quote from Martin Luther King Jr. that says, if I can do great things, I can do small things in a great way.
Great point. Amie, you have to be unmuted. Joy is going to unmute you. Maybe she's not. Oh, there you are.
It's a little hard to follow Martin Luther King, let me just say. But you know, I mean, I just, it's an old adage, but I think we rise and fall together. And really and truly what Jeff said is true, in that what happens in our movement here has impacts elsewhere and vice versa. And we really, this fight for our human rights is not anywhere near done. And we all need to be pulling our weight to make sure that we succeed in the long run, and hopefully sooner rather than later. So there you go.
Michael?
Yeah, I just want to echo what Amie said. You know, the fight is far from over, but I think it also goes to show that I think people need to really realize that the LGBT community is very much a part of society on a whole, and they have so much to give to the community. And, you know, I think that we need to really fight. It's unfair that we need to fight to prove that, but, you know, we're thankful for all the work that's being done. And I know that we're some of the strongest people out there, so yes.
I think that's a great point for us to end on. I want to, again, thank everyone. Please join me in thanking our great panelists. I will applaud. I don't know if everyone else has their camera off, but I'm sure they're applauding as well. Thank you, Jeff, for your continued work. Thank you, Amie, for your amazing research and your amazing service to our community. Jenny, I see you waving. Michael, thank you for the great work. And everyone needs to visit Barbados and stay and patronize LGBTQI friendly businesses. If you want to get more involved, obviously the websites are in the chat room. There's another way. Outright has participated last year in the LA Marathon. So if any of you are runners and want to participate in the 5K or run the half marathon with us or the full marathon, we'd love to have you join our team. And I know the center also has a 5K run at the same time as part of the LA Marathon weekend. So those are great ways to support some local organizations and get some fresh air. And finally, I want to thank Joy for pulling us all together and for her technical assistance. Thank you, everyone, for being with us tonight, and stay safe out there. And again, happy Pride.
Thank you so much.
Thank you. Happy
everyone.
Pride.
Thank you, John. Another
Thank
beautiful
you.
program. Thank you, West Hollywood.